Hospice is palliative care, but palliative care is not all necessarily hospice. Let me tell you why. Palliative care is a term that I often find a little bit confusing to some patients as to what it means, and a lot of people conflate it with hospice. It is true that hospice is part of the palliative care specialty, but not all palliative care is hospice. So if you're wondering, stick around for the rest of the video. So think of hospice as a model of a car within a make. So you have Honda Civic, Honda Pilot, Honda, whatever the truck name is, and the Honda itself is palliative care, and hospice is just one of those cars. Palliative care is a service that is indispensable, in my opinion, to patients, and it's a service that allows me as an oncologist and cancer specialist to take better care of my patients, because I know I have the help of my partners in the palliative care department. And they are a specialty that I refer oftentimes my patients with cancer. Obviously, I don't take care of patients with other chronic conditions like lung fibrosis, COPD, or heart failure. I don't take care of those patients, so those specialists would do the same thing, would refer patients to palliative care. But my patients, I think of palliative care for them when they come in with no concerns of their survival in the near future, but they have symptoms. They have symptoms from their cancer, pain, anxiety, insomnia, significant constipation, or side effects from treatment. Those are the patients I think of palliative care as an invaluable source for. So if you have anxiety and you're going through treatment and you have cancer and you have other things going on in your life, there's palliative care for you. If you have pain that we have been trying to get under control with a couple, regimen changes, uncontrolled constipation as a result of these opioids for pain control, that's palliative care for you. So it becomes a very important partner to me in ensuring that I take care of my patients the best way I know how. Now, hospice is, like I said, a service within palliative care, the service that takes over when those patients are nearing the end of life. So when we've exhausted treatment options or the patient is not able to take any additional treatments, then our hope and our goals shift from treating the cancer and trying to support the patient through the treatment process to focusing on the patient now and trying to give them their best days before they pass on. Get their symptoms under control, get their spirituality and their psychological well-being in its best shape. So it not only helps patients, but it's a huge resource for the family as well. So in summary, palliative and hospice care improve quality of life, improve quantity of life, improve patient as well as family satisfaction, symptom burden, communication between the patient's family with the rest of the healthcare team, reduces hospitalizations, reduces unnecessary aggressive interventions and treatments, and reduces healthcare costs. All of these are proven benefits that hospice and palliative care provide to patients and their families. So please ask your provider about hospice and palliative care and whether you'd be a candidate for either of those two. Good luck.